Now, you may remember last month we brought you an extraordinary story of Jemma Pixie-Hixon, 20 years old, an internet singing sensation, but only on the internet because she suffers from agoraphobia, so she can't leave her home.
We introduced her to a psychologist called Jennifer Wild, who's now working with Jemma on a treatment programme to help her conquer her fears. Breakfast's Graham Satchell has been looking at their progress.
Just gonna stand there and watch me burn. That's alright because I like the way it hurts.
Her voice has made her an internet sensation. Jemma Pixie-Hixon has more than 2 million hits on YouTube.
Just gonna stand there and hear me cry.
Jemma hasn't been able to take advantage of her popularity because she suffers from agoraphobia. She hasn't left home for 2 years.
I'm not able to do normal things that people do, like I've never been to a club or go for walks or go to the cinema, shopping, you know. I can't even get to the doctors if I need to, so I have to have telephone appointments. It's just everything you could imagine, really. It's been really hard, to be honest.
Good morning. That's wonderful music, all composed...
Jemma appeared on BBC Breakfast from her house with clinical psychologist Dr. Jennifer Wild, who seemed to offer some hope.
It's not impossible to treat. CBT is very effective for panic disorder and agoraphobia, very, very effective. And that's what I would want to be offering Jemma.
So, we brought Jemma and Jennifer together.
Hi, Jemma, it's Jennifer. Okay, Jemma, so we're going to meet for about an hour and a half today. So what's the main symptom you've been having in the last week? What's been troubling you the most?
Probably all of the panic attacks and anxieties.
Dr. Wild's initial assessment is that Jemma has debilitating anxiety problems that started when she was 6 or 7. But the trigger for the agoraphobia came after Jemma's mum was diagnosed with a brain tumour.
Jemma's mother was ill when she was 13 years old, when Jemma was 13 years old, and this led Jemma to become quite anxious about some health issues. So these symptoms were similar in a panic attack as to what her mother had experienced. So she then, when she had a panic attack, wanted to avoid having more, and gradually her behaviour became very, very restricted so that she was no longer able to leave the house. It's really nice to meet you, Jemma.
Dr. Wild will treat Jemma with cognitive-behavioural therapy and is confident in 3 months she'll be able to leave the house.
I really want to just get better because, you know, that's the main thing is, you know, it's all fine me recording in the house, but you still don't want to live in fear every day and not be able to do normal things. But I would love to be able to get back on stage again and perform in front of thousands of people. That'd be amazing.
Jemma will continue to record songs in her bedroom, but she's hopeful the new treatment programme will finally allow her to follow her dream. Graham Satchell, BBC News, Worcestershire.
Well, she's making progress, which is great.
She is making progress. 3 months, they were saying, it could take, so we'll follow that progress. Of course, when we spoke to Jemma...
Well, she lets us back in the house again.
Yes, exactly. She did say she wants to be out on the stage, didn't she?
We'll get in here, on the sofa,
do you think?
playing, yeah.
Jemma, are you watching? This is Breakfast coming up after 8 this morning. The fashion